I give you one element which also is present in COVID-19. Many people, they have a poor diet. They do not have enough vitamin C and not enough polyphenols, bioflavonoids, these vegetal pigments, which we find a lot in fruits and vegetables. So when the body has not enough vitamin C and polyphenols, then the arteries, and especially the small arterioles and the capillaries, become brittle. So it comes a lot of small hemorrhages. When it's a small hemorrhage, like when we bite an apple and then we see some blood on the apple. Okay, so this bleeding, small bleedings from the gums, from other parts of the body, it is a sign that the capillaries are too fragile. And what happens on these hemorrhagic places, microscopic hemorrhagic places, it comes the platelets, it comes calcium, it comes fats to block this wound. And if this happens all over the body, sooner or later the blood flow will be diminished. We'll get more and more atherosclerosis. So the arteries, the arterioles will become more and more rigid, and this is a big problem for the heart. But if you go to the cause of the cause of the cause, it's not only the cholesterol which we eat, like fats from the food, but it's also this lack of vitamin C and of polyphenols. When you get vitamin C and polyphenols, the arteries are very flexible but solid in the same time. They are not brittle. Okay? In the case of COVID-19, when the virus enters into the lungs, it comes on the area where are the alveoles in contact with the capillaries from the lungs. And if the capillaries, they have an endothelium, which is very soft, very brittle, very weak, then the virus can penetrate very easy and will cause a lot of hemorrhages. That's why one of the symptoms in advanced phases of the COVID-19 is hemoptysia, which is spitting out the blood. So taking vitamin C and propolis especially, and a lot of polyphenols will strengthen the capillaries so the virus cannot penetrate so easy and cannot make aggravation. To recap, here we need very good air, very good protection, very good water, very good hygiene, very good relaxation, very good non-stop repairs and regeneration, and then we need a very good nervous system and a very good cardiovascular system. And if we keep under control also the negative emotions, then the body will function properly, will be full of energy, and will be able to fight the coronavirus. Let's go now. This was the general introduction with all kind of theories, but which are very, very important, because if we do not follow the rules and principles related to our health, we cannot have a very good health. Now I will give you step by step what to do in case you are in contact with coronavirus or you have symptoms at the beginning or in the medium or in advanced phases. So let's go first of all with the prophylaxis, which means you are a healthy person, you are just a normal person, and you want to protect your immune system. Okay, so here we need to follow the basic rules like I said before. Very good nutrition, small amounts of foods, very good quality, baby food, like food which can be very easy digested. We need to have fresh air, always refreshing the air in the room. Good protection of the body against bad bacteria, and here is including to have a diet which attacks this bacteria. For example, eating a bit of onion, a bit of garlic, and spicy foods, which will maintain the pathogen, these bad bacteria, under control. Okay? Then we need plenty of water, and remember, warm water. So if it's cold water, is very, very bad. A good sleep, a lot of sleep, at least 8 hours, and going to the bed like 9:45 p.m. A good hygiene inside. The regeneration means to have all these foods, all these amino acids and vitamins and carbohydrates and lipids and so on and so on from a good diet to help the liver to regenerate. And pollen, bee pollen is very good in this situation. Then less stress, going early to bed and avoiding the negative emotions. And then helping the cardiovascular system. Cardiovascular system can be helped also if we do, even in our home where we are, just small amount of exercises, gymnastics, just moving a bit, making some flexions and things like this will help the cardiovascular system to work properly. Okay, so these are the basic rules, but also it is a very good idea to take beehive products like the beekeepers to prevent the occurrence of the disease. And let's look to the beekeepers. Beekeepers from all over the world, they have a better health. Even if they go through many epidemias of flu and so on, they are healthier than the rest of the population. And also, they live longer than the rest of the population, which is fantastic because if you think they live longer, like a study made in Germany showed statistically that the beekeepers live three years longer than the rest of the population, which is like old people when they have maximum of bad diseases like cardiovascular diseases, diabetes and so on. If they can go through this time, which is a very difficult time of our life, the last part of our life, it means that beehive products are very, very useful. So we should take at least 20-30 grams per day of honey, ideally forest honey or honeydew honey or multifloral honey, or if it's possible, chestnut honey, which is more antibacterial, thyme honey, lavender honey or manuka honey, which are more antibacterial. So honey should be replacing the sweets based on sugar, because the sugar is a very bad enemy of the immune system. So there are many studies, sugar just diminishes the power of the white blood cells like 30% in a very few minutes. So honey, honey, honey. Now the best honey is raw honey, ideally from honeycomb honey if it's possible, at least for the future use this rule. And use it in many forms, like you can take it orally. You should keep it under the tongue as long as possible and then swallow. And if you have complications and problems, then you can take honey on other anatomical ways. So besides honey, propolis tincture, propolis, all forms of propolis are useful. As prophylactic, 1 drop of propolis tincture for every kilogram body weight. Like I have 87 kilogram body weight, so I need 87 drops to take in a day. Like every liter of my body needs at least 1 drop of propolis tincture. So, if the situation goes bad, then I need to take more and more propolis. Okay, then I need royal jelly, 1 to 3 grams a day of royal jelly is very good. Bee pollen, 20-30 grams a day, it's also very good. Then it is a good idea to take some bee bread if I have beekeepers in my area which can give me, or I can find to the health food stores. Bee bread is also good, 10-15 grams a day. And also it's good to use bee venom creams. There are special bee venom creams you find in internet or especially made health food stores. And the bee venom cream can be used on acupuncture points to stimulate the blood flow. Okay. So these are the general rules for the population to prevent the disease, and of course we need to respect all the rules and recommendations from our governments. They are okay, they are right that we need to do this social distancing to make physical barrier to not allow the virus to come so easy. This is okay, but we need to respect all the other rules. And very, very important again, a good sleep and a lot of water. Okay, now if the disease, the virus, let's say it came through the nose, first contact to the nose, then we need to be sure that in the nose we have enough water, not too much mucus, but enough mucus to block the virus to get attached to the nose mucosa. And here it comes, there are many devices you find in the internet like sprays, like mouth spray, throat spray, but also nasal sprays, which we can use. And also we can use saline water, like warm water, like 42 degrees Celsius with enough salt, ideally sea salt, and then we can go through the nose with these solutions. But also we can use in apitherapy, honey in the nose, like a few drops you take with a syringe, a few milliliters, 1 milliliter here, 1 milliliter here, and you just clean the nose, because honey attracts a lot of water. And honey itself can be antiviral and also it's antibacterial, well known. So when you put honey through the nostrils, then when you feel sweet here in the throat, in this area, it means that the honey went through. And it's true, the honey is very, very powerful because it's acidic. It will burn the nose mucosa, biochemically speaking. But this feeling will go away in 2-3 minutes. You will get maybe some tears. If you are very sensitive, you cannot do this like 1 ml of honey in each nostril. Then you can dilute the honey. In the hospital area, you can use microfilters. So you just put a syringe here, a couple here the syringe, and then you can get honey inside the syringe. Then you get a saline solution which is sterile, and then you pump this solution which is homogenized through the filter, and here the honey will be sterile. So sterile honey can be used for the nose, for the throat, for swelling, for inhalations, and so on and so on. Okay, now again, remember this thing, we should not open the nose brutally like with medicines, but we can, if it is too much runny nose, too much mucus, we can dry it with a very simple method, which is the hair dryer. Many ladies are using the hair dryer after they take a shower. So we put the hair dryer at a distance like this, not too far away, not too close, to keep it, to be able to breathe this warm and dry air for at least 15-20 minutes. And then this heat and this dryness which are coming will unblock the nose and will open normally, physiologically, the nose. And also another very important thing, according to the scientists, the virus cannot resist to temperature like 55-60 degrees Celsius. It's already destroyed by the heat. Or here on the fan, this hair dryer, we have even higher temperatures. So it's a longer period of time, so it can destroy the virus also physically. Now, if the virus arrived here in the throat, in the pharynx area, and the people, we get the sore throat, then we have big advantage again, because it's a very easy to access area. It's not like a deep area in our body, like in the bones. So here we can do a lot of gargles. And the recommendations are to use gargles with saline solutions, like just warm water, 42 degrees Celsius, and then enough sea salt inside, and then just gargling. We can also do gargling with vinegar, water and vinegar, ideally honey vinegar, or oxymel, it's another word here. And we also clean the throat about this. Also, we can use lemon juice in warm water with honey, and we can do it here. And also, then we can clean the pharynx with just honey and water, ideally honey, water, and some lemon juice or some vinegar. And then after we clean the throat, after we do the gargling, we should spit out. A few times we'll do like this. And then we should take a medicinal honey bee products propolis preparation, which will stay on the throat and will protect the throat against the viruses. And this is we can do a mixture of honey and propolis, like honey 95% and 5% propolis. And then propolis you find in a lot of health food stores, all kinds of propolis, more or less concentrated. And then you can combine in the honey. And then from this honey you take 1 teaspoon, you put in warm water or warm tea, and you do again the gargling. And then you swallow. You need to swallow, because when you swallow, the rest of the viruses which are still present there in the throat will be swallowed, and it comes, as I said before, in the stomach, and the stomach will destroy the virus. This is very, very good to do. So after this gargling, it's good to take just a teaspoon or 2 teaspoons of honey propolis, maybe with royal jelly if you have in this mixture, and this swallow. And this will just like paint the pharynx with these substances which are protective substances against the virus. But also very important is that if you go deeper from the pharynx, like you go with the microscope through the mucosa of the pharynx, you'll see cells there around, and it's like a wall. And behind this surface, inside here, there are a lot of macrophages and neutrophils, which are very important cells from our immune system. And they are like they're like soldiers, if you want, around here. And if a virus comes here, it will be immediately destroyed. But if we have here a cold area or a too dry area, dehydrated, then it's not good. And the virus, in brackets, it's clever, because this type of virus, this SARS-CoV-2 virus, it causes dryness in the area of the throat. So because it does not want to be swallowed to the stomach, It's like a microscopical intelligence, nature's intelligence if you want, a bad intelligence. So we need to fight against this situation and to improve the local immune system. And there are countless articles on the effect of beehive products against the virus bacteria, but also to improve the immune system locally, like phagocytosis, like the power of eating of the white blood cells of the viruses, and so on and so on. Good. So gargling a lot of beehive products and maintaining the throat here wet, which means every 20-30 minutes we need to drink some warm water. Good. If the virus was not blocked until this moment and it arrives to the bronchia, trachea and bronchia, and we get coughing, it's a dry cough. This is a characteristic of COVID-19, and this dry cough should be eliminated, blocked, by taking beehive products which are improving the expectoration, the humidity in the bronchial area, and this especially the best honey type here is linden honey. And linden honey, if we take it in linden flower tea, we have special substances from these flowers which are improving the elimination of the humidity, creates humidity here, but also helps the elimination of the fluids from the lungs. So honey in this situation is very good. And then also in some cases propolis, ideally propolis, which is a water extract of propolis, like I have here from Brazil. It's a water propolis extract, but also there are many preparations from European kind of propolis, which are water propolis extract. Basically you take raw propolis and you make it very, very powdery after you keep it in a freezer for 24 or 48 hours. And then you make it a powder through a coffee grinder. And this powder of propolis you put in warm water, 60, 70, 80 degrees Celsius for about 30 minutes. And then you'll get a water solution, you can filter, and you'll get a solution which is having very, very clear taste of propolis. So this one can be used for such a thing. And then a water propolis extract or an oil propolis extract, like propolis in sunflower oil or olive oil or argan oil, whatever oil it's good to eat. Then this will protect better the bronchia against the virus. Okay, now through all these phases, when the virus is on the nose, on the throat, or it's in the bronchia, we should use also another device. If the virus already arrived to the nose, in the throat area or in the bronchial area, it is a very good idea to use devices which are propolizing the air in the room or also directly to our nose. So one of the devices is this device made in Italy, which has here a capsule, and in the capsule is put propolis, refined propolis without wax, very small amount of wax, and now 5% can be myrrh. And here the device has inside an electrical part, and here is a ceramic cylinder, and this becomes hot. The temperature is about 80-82 degrees Celsius. It's the best temperature for propolis to become liquid. And then propolis from this liquid slowly, very, very slowly goes into the air. One capsule like this, it's enough for 123 hours. So such device should be present in all the rooms where the patients are staying, even 2, 3, 4 such devices in the sleep room, in the dormitory, and should be almost like 24 hours a day should be active. And then when it's finished, the device will tell you it's empty, the capsule, so you can replace with the new capsule. Okay, so this is one of the devices which can be found. It's Propolair. And then we have here another device which is made in Slovenia. It's Propostim. And this is based on the same concept like the heat electrical system. And here you put, here on this small shell, you put propolis. It does not look very nice, but it has propolis inside, which is having this color, brown color. So you put first beeswax, and then you put propolis, raw propolis on top of it. And then this system here becomes also hot, exactly to 80-82 degrees Celsius. So the propolis will go in the air of the room. And this system comes also with the possibility to have a mask, attached mask to this one, so you can breathe directly if the symptoms are really stronger than normal. And another This was the device from Slovenia. Steam is the name of the device. Can be found also on internet. And then we have here a very common, very useful device, which is a nebulizer. And we find such nebulizer. There are several types in any pharmacy. And this nebulizer is used by many families which are having problems with the children, which are having breathing problems like asthma, bronchitis, chronic bronchitis, and so on. In the hospitals or in the clinics, they put in this special container here. They put medicines, chemical, synthetically made drugs like cortisol and so on against the asthma. Now, in apitherapy, in natural medicine, we recommend to put here natural compounds which are having not only anti-inflammatory results or antibacterial, antiviral, and so on, but also they have an immune stimulating effect. So how to do it? The order is of this recipe. You can take a piece of paper and then you can stop now the video and then come back because I will tell you the recipe. And the recipe is like this. First of all, you need a container, a glass container, which is sterile. And you take a syringe from the pharmacy, and then you take in the syringe 0.5 milliliter of honey, ideally honey which is also antibacterial and possibly also even antiviral, like chestnut honey, honeydew honey, forest honey, thyme honey, lavender honey, eucalyptus honey, or manuka honey. And then you take this 0.5 milliliter honey, and then you take in the same syringe propolis tincture. Like you have propolis tincture like here, propolis tincture, it is like these drops. You'll see it, it's more or less fluid, so it goes quickly out. It's not so concentrated, 20-30%, but it's enough to take it. So you need 0.5 milliliter of tincture too. You take in the syringe, then you can mix it a bit, and then you can also take in the syringe at the end physiological serum, which is sterile from the pharmacy. You can order, or you just boil water, or you take distilled water, which is sterile, and you take in the syringe 3 ml. So I repeat, 0.5 ml honey, then 0.5 ml propolis tincture, and 3 ml physiological serum. Then you mix in the syringe to get homogeneous solution, and then you pump it directly into this device here, into the nebulizer. Now it's clogged a bit from the propolis. So you take this one, and then you pour your mixture you have in the syringe, and then you pour it here slowly into this container. If the disease is very advanced, or you want to be more careful, let's say you have already the coughing, then it's good to add here in this solution also 1 drop, maximum 2 drops of an essential oil which is antibacterial or even antiviral, like rosemary oil, like thyme oil, like pine oil, and all these oils which are coming from the trees like Abies alba, fir tree oil. And then also Melissa officinalis oil. It's very good for this. So you add only 1 drop of this oil, maximum 2 drops. You mix it here, then you connect again this part. Okay, you connect it, and then you just activate the device, and this will pull the air from outside and will push it here through this tube. Then the air goes through this solution here, and then you can breathe it normally. Yeah, so you'll breathe it normally. At the beginning, you need to keep the mask at a distance to the nose, because what comes out, it's like fog. From here it comes the word nebulizer. So, but at the beginning, this is a bit disturbing for the nose, and you may get a bit of like coughing because of this air which is coming. So you need to come very slowly, closely to nose, let's say in 30 seconds, 1 minute, and then you can breathe normally until the whole solution here from the container it's used. Yes, this can be done As a preventative thing, if you have the virus in the nose or the throat here, like 1 to 2 times per day. But if it's more severe, like in the bronchi or it's deeper inside, you should take like 5, 6 every hour, one session of this nebulization with the propolis and honey and the essential oils. Now, what beehive products are the best if we have here the sore throat? I told you gargles with honey and salt and so on and so on. But also we need to take inside to swallow more quantity of propolis, of honey, royal jelly pollen and so on and so on. So you can already double the amount. Like you give 2 drops of propolis tincture for every body kilogram of body weight. Then you can get also some more extracts of propolis, like water extract. You can get oil extracts, and also you can use propolis in form of suppositories or ovules, 1 suppository per day. Then you do the inhalations like I told you before. And then royal jelly, you need to go like 5-6 ml of royal jelly per day. And then pollen, you can go like 40-50 grams of pollen every day. And honey, you can go like 50-60 grams a day also. When the disease goes deeper, like in the bronchi, and you get the coughing, the dry coughing, then you can triple the doses, like it was I told you at the beginning. So 3 times more amount. And if it's deeper, like you have lung infection or this like pneumonia, the doctor should administer the beehive products through the air here, like inhalations. Also under the tongue, when the patient can swallow a bit of water, and also intravenous. Now, I know that most of the medical doctors have never heard about intravenous use of honey, but there are professors, one professor very good, very famous in Egypt, which is using honey intravenous. The idea is like with the vitamin C, if you do intravenous administration of a substance, it is much more effective than when you swallow it like a food. So the best method for the doctors to accept it, hopefully, in their hospitals in case of emergencies, when nothing else is helping, then they can take honey, a good quality honey, into the syringe. Honey which is mainly antibacterial, like I told you before, chestnut honey, honeydew honey, forest honey, thyme honey, lavender honey, eucalyptus honey or manuka honey. And then you take physiological serum which is sterile, and then you microfilter it, and this honey is sterile honey. And this solution can be injected intravenous. Professor Mamdouh Abdul Rahman made over 1,500 sessions with intravenous honey. Also in Germany, in the years 1950s, it were many reports and articles, scientific articles about the use of honey intravenous. And of course there are some possible adverse reactions, but they are not so dangerous, and the honey in this situation is much more useful than the possible danger which is causing maybe like a adverse reaction. But the adverse reactions are usually a short time, and then afterwards it comes to the real healing. So what would be the best concentration? The doctors can decide. They can start from 2%, 3%, 5%, they can go even to 10% honey in this solution, which can be administered slowly through perfusion. Okay, good. And in case of, again, inflammation very deep inside the lungs, pneumonia, then the doses of all bee products should be like 4, 5, 6 times higher, like I told you before. Even like 5 ml of royal jelly every hour or every 2 hours, as much as possible, because if you split it, give smaller amount all over the day, many doses, then the body can tolerate. If you take everything in like this, then the body can also, of course, react with an adverse reaction. But if you split it all over the day and even during the night, it can be applied very well.